Hello everyone, welcome to Rapid Review for MRCEM exam. In this session, we will discuss a single best answer question on the topic of pelvic trauma. Please go through the question and the options available and decide what is the correct answer. I am here with Sam, A&E trainee, who will attempt to answer the question. Okay, Sam, I've got the next question for you. A 45-year-old male who is brought to the emergency department after being struck by a car while crossing the street. On arrival, his vital signs are as follow. Heart rate is 130 beats per minute, blood pressure is 80/50, respiratory rate is 24 breaths per minute, and oxygen saturation is 94% on room air. He is pale and aphoretic and with altered mental status. There are no obvious signs of external bleeding, but there is bruising noted over the lower abdomen and pelvis. His left leg appears shorter and externally rotated. The question is, what is the most appropriate immediate management step for this patient? Before you go through the option, can you just tell me what could be the underlying injury?
Yep, okay, so in light of his tachycardia and hypotension, I'm concerned that maybe he's got significant blood loss, so maybe a major hemorrhage. There's no external bleeding, so potentially in the abdomen or pelvis. The fact that he's got an externally rotated and shorter left leg, it could be dislocation, but in the context of potential hemorrhage, I'm wondering if maybe he's got a mid-shaft fracture or a pelvic fracture. But either way, blood loss is a big concern in this patient.
Great. Let's go through the option now. So the question here is most appropriate immediate management.
Okay. So option A, perform manual manipulation of the pelvis to assess for instability. So we definitely don't try and spring a pelvis anymore for fear of dislodging any clot that may have already started to form. And I don't think manual manipulation is going to help. So I'm pretty certain the answer is not A. B, obtain a CT scan of the pelvis for further evaluation. This is something we're definitely going to need to do by the looks of it, but in terms of the most appropriate immediate management, that's not necessarily going to help this gent's blood pressure and heart rate. So something to be done, but not immediately. C, place a pelvic binder centered over the iliac crests. So I do think this guy needs a pelvic binder. However, pelvic binders should be at the level of the greater trochanter. Often we see them put on way too high, and iliac crests are too high, so I don't think it's C. Okay, and D, place a pelvic binder centered over the greater trochanters. Yes, this is the correct answer. The placement should be, it's always lower than we think it is. And E, initial fluid resuscitation and observe for improvement before any intervention. With a gentleman like this, I think we need to replace like with like. So I think we'd be heading more towards a major hemorrhage protocol with blood transfusion rather than fluids. And we definitely need to do something before just waiting to see if a bag of fluids improved his condition. So not E. So D.
Okay, great. So let's go to the option together. So the option A, perform manual manipulation of the pelvis to assess instability, definitely is incorrect. Manual manipulation of the pelvis is discouraged in the early assessment as it may dislodge an existing blood clot and worsen hemorrhage. Option B, which is obtain a CT scan of the pelvis for further evaluation. As you said, a CT scan may be useful for detailed imaging, but it's not the immediate priority in a hemodynamically unstable patient. Immediate stabilization is required first. Option C, which was a tricky choice, place a pelvic binder centered over the iliac crest. This is incorrect, as you mentioned. The pelvic binder should be centered over the greater trochanter, not the iliac crest. Incorrect placement may fail to stabilize the pelvis effectively. Option D, as you said, which is a correct answer, place a pelvic binder centered over the greater trochanter. In a patient with suspected pelvic fracture and hemodynamic instability, a pelvic binder should be applied immediately over the greater trochanters. It helps to limit pelvic volume expansion and reduce bleeding. And option E, and you have said correctly, that is a wrong choice, which is to initiate fluid resuscitation and observe for improvement before any intervention. Fluid resuscitation is important, but now if you go with the NICE guidelines, pre-hospital they can give up to a liter of fluid, but in hospital if someone needs resuscitation, is going to be blood, and in this kind of situation we need to activate the major hemorrhage protocol, and this is not the correct choice. So you are correct again. The most immediate management step is to place a pelvic binder centered over the greater trochanter. Great, well done.